You are listening to Puzzle Science Podcast. Hello, lovely people. So, after a couple of weeks, I am back with season 2 and a new episode. I would like to start with a little bit of personal information. As I started recently a new job, it can happen that some episodes would be a bit late, and this is definitely not my aim, and I will give my best to avoid this, but if it does, please bear with me. I'm currently on a relation between Italy and Austria, and editing and recording in parallel is quite difficult sometimes. One additional new thing is that starting with this episode, conversations will be available on YouTube with Serbian subtitle, so that shouldn't be a limit anymore for people who want to hear this. So please share with anyone you think will benefit these kind of conversations but might not fully understand English. And in addition, episodes from season 1 will be added to the YouTube channel in parallel, how my schedule allows, and I will share them here once available. So last season we finished with recapitulation of what was happening in Serbia at that time. Just as an update for people who are interested, protests are still occurring regularly and they are more massive. I will do a separate episode about that with the whole overview and update regarding which kind of activities are happening around Europe supporting students. And in that light, I am very excited to share with you today a conversation with Nadežda because she is also a very passionate supporter of this kind of protests like I am. And this episode is one that I think is a basis for today's health and generally today's life. I had a conversation with her about rare diseases, as she is one of the persons suffering from one called porphyria. And I found her to be an extremely great counterpart to talk about this. As she's also a patient advocate and a global patient representative with her own organization, we tackled all about this disease, but also about other rare diseases. We discussed about the relevance of support, surrounding, understanding of people around you, lifestyle, and general environment in dealing with rare diseases. We are doing a deep dive about shame surrounding a term, okay, I have an XY disease, doesn't matter which kind of disease is. And we talked about empathy versus pity and victimization, therapy availability, relevance of systematic change, and not so bright dealing with rare diseases in countries as Serbia. I really enjoyed this talk and I'm very grateful to know a person as Nađa. And until the next one, don't forget what I always say, listen to your hearts, not only to your ears. So, welcome Nađa. I'm very glad you're here.
Me too.
This was really, I don't know, it's a blast from the past, I would say.
Yes, it is.
I'm happy to have today as my guest Nađa. She will say a little bit more about her, but we went together to our high school, our pharmaceutical high school in Vršac, and we were together there in the student dorm, basically, high school dorm. So it was a very nice experience. And yeah, I'm happy we are still in touch. This is usually rare, I would say.
Yeah, me too. Like, I think that you stay in touch with people over the years, especially with people that, follow the same quality or path as you would like to.
Yeah, that's true. Yeah.
So I'm glad I can see you in person now. But yes, I'm pretty proud that I met you and that you've been part of my life or childhood.
Thank you. Yeah, that's true.
So,
me too.
Welcome to Belgrade.
So maybe you can start with a short introduction. Who is Nađa and what is Nađa doing?
Nadia or Nadežda is patient advocate for rare disease called porphyria.
Mm-hmm.
Also, I'm a sister, daughter of family members that have the same rare genetic disease. I'm also involved in a rare disease community in Serbia, but also abroad into Global Porphyria Alliance. And starting in 2025 and into 2026, I'm going to be a global patient representative with IPNET, which is International Porphyria Network. And I'm also a pharmacist, so it's kind of a funny story how everything went. Starting with a goal to be a scientist, researcher, and a pharmacist, and then getting the diagnosis and basically switching your path to something different. I'm still in the area, but it's completely a different approach and different point of view.
Yeah, definitely. And if we go back a little bit to this before knowing the diagnosis, you mentioned we went to the same high school, and this is one very cool thing there because we had a lot of lab. So we started being in the lab very early, and we had really this touch with science and doing some stuff, I would say, very early. Maybe not on a quality that we would like to, but it was still very useful, I would say. And at that point, you dreamt of becoming a scientist, or what you wanted to do?
Well, I didn't have a pretty clear picture of what I'm going to do, but it definitely cleared out the path for me. I decided that I want to be a pharmacist and nothing else, which definitely helped me later on during my university. I think that our high school was pretty good, even well equipped, comparing to the university that I went in, for example, Belgrade. I could notice that among all the students there, I was very well educated, both in theoretical and practical knowledge. And I was proud. I was not aware of that while I was going in our high school. So it's definitely a good ground for future scientists to go to.
Yeah,
Chemical medical school, Vršac.
Yeah. And when did you learn about your diagnosis?
It was my second year of university.
How that started? Did you was it straightforward in that sense, or it took some time?
It took a lot of time, actually. It was we call that in rare disease community diagnostic odyssey. But it started being like a smart kid and knowing everything for porphyria, which is the disease that I have. It goes like you are experiencing some sort of symptoms. They are not always so severe, so the diagnosis could be pretty hard because disease imitating different conditions. So for me, it started, of course, in lab. I was having like mild or sometimes severe toxicity. And I started having like a brain fogs. It definitely affects your ability to think, speak, or to verbally say something.
To express how you feel, basically. Yeah.
Not just how you feel, but like before I entered the lab, I was a student that was preparing like scripts for all students in my group. So I was definitely 100% aware that I know like the matter. However, when I entered the lab, and 30 to 40 minutes into the lab, started being confused. I started to stutter. I started to write something down, then I cannot remember what should be like written there. So I was in panic, but I tried to add those symptoms to like exhaustion or something along those
Stress,
lines.
yeah.
So maybe a year after my first symptoms started, my sister had an attack. So her state was pretty serious. She had 2 heart arrests. Thankfully, it was in ER, so we managed to save her.
And she was at that point how old?
She was 20.
Okay, so definitely not expecting a heart attack.
Correct.
Yeah.
But it started with some less severe symptoms at home. I was also starting my, like, so to say, residency in pharmacy. So during that time, of course, because I'm that kind of person, I was ordering like scientific journals, and I was so thrilled that I can learn at university, then read in paper, then go to pharmacy and apply everything that I know. So during that period, it was pretty frustrating to experience that, you know, my sister has some issues and I cannot help her. I can help like all people that I meet daily, but I cannot help my sister. Eventually, after about like a week spent in hospital, like 24/7, one of the physicians suggested, he actually asked us, where are we coming from? And when we explained that, like the region, which is like northern part of Montenegro, he then suggested to do like a specific test, which was porphyrins in urine, and that confirmed the diagnosis for my sister.
So this is a specific disease, let's say, for that part.
Well, I'll go back to the future and today. But since it is genetic disease, it is a rare condition. However, in Serbia, the Raška region will be probably announced as endemic region for porphyria, which is, I would say, unique region in the whole world, because there are some communities around the world that has porphyria, but with this specific mutation that we have like 2 most common mutations. I've also learned that, for example, in Sweden, all patients that have acute intermittent porphyria are actually from Balkans.
Okay.
So
there is something happening there.
yeah, for sure. So that's how my sister found out about diagnosis. Then we've learned that it's genetic. I did biochemical test. My porphyrins were elevated. And I just received a paper from the lab, and that was it. That was like 12, 13 years ago.
So you did it self-initiatively, basically?
So basically what happened is that around that time, since I was in pharmacy and pharmaceuticals, of course that I went online to see what kind of clinical studies there are and stuff like that to help my sister solve the issue, because we just received the answer like, oh, this is a past disease, you just need to eat sweets. Wow, what a treatment. Yeah. So going back home, I started realizing that during university, not all doctors, not all pharmacists or medical workers are well aware of different rare diseases. There is like 6,000 to 8,000 different rare diseases, and there is also like 5 different gene mutations are discovered, new mutations every week, which is insane to like catch up on. And I decided to use my brain and see what I can do. So being in Serbia, it was an easy job, I can say, because we are so poorly equipped, and even the small changes made a huge difference, at least here. But it's not just being smart what would be sufficient to make a change. So you need to be persistent, you need to be willing to change stuff, especially if you're trying to change something systematically. So eventually I started my organization, which is a national organization, Association for Porphyria Patients in Serbia. Then I've joined National Association for Rare Diseases in Serbia, and then I've started being a global patient advocate for porphyria.
Basically to get this ball rolling of, and support people that have these rare diseases and in general. If we just maybe to give a little bit of background to people that maybe don't know, how rare diseases are defined, and then maybe a bit more about your specific disease.
So rare diseases are actually diseases that are happening in a small groups of patients. So for example, 1 to 10 people on 100,000 of population. The thing or the issue with rare diseases is that even though they are rare, there are so many rare diseases that probably every 10th or 15th person in the world has some rare condition, like genetic condition, which is definitely something that we should not like emphasize, but really put into people's mind. Again, living in Serbia, we are completely aware that people don't care much about an issue unless that issue affects them personally. But nobody will guarantee that your child or one of your siblings won't have rare disease, because there is a different kinds of rare diseases. Some of them you can notice and diagnose basically hour into birth, but there is also a lot of diseases that are with adult onset, and there is also like diseases with visible disability, but there are also diseases without visible disability.
And so, this challenge also that you mentioned, that usually they have symptoms that are attributed to some other diseases.
Correct.
And it's very, also I think it comes also from the doctors and their knowledge to know that, okay, this specific, because as you mentioned, there are so many mutations, there are so many things being discovered so fastly, and then for them to catch up and to know that this is maybe potential diagnosis is very hard, to find
correct.
that.
Correct. Even in developed countries where you have all diagnostic materials and machines and whatnot, even then you need like a critical thinking doctor or physician or someone that would think outside of the box. So basically being more into like Hollywood and romanticizing things, but we need one Dr. House all the time. And this is so important for people that are living in rare disease, with one of the rare diseases, that we are so common, but so specific. Treatments are so rare and so expensive. I can go about like pharmacoeconomics, but we can continue with that story later.
Yeah, we'll definitely.
But it's
touch that,
definitely an important issue because people that have a diagnosis of rare disease are waiting usually more than 5 years to get diagnosed, and then after getting diagnosed they are also waiting a long time for a treatment, if there is any. If there's a treatment is usually expensive. So in Serbia we have a huge issues with therapies. Let's start with like treating sick kids with text messages. Then when you have like a therapy, there is a different regulations you need to follow. Everything is about like politics. Sometimes I feel that kind of pressure. Okay, I need therapy for rare disease that I have, as well as patients in my group or community. But those are like adult onset disease patient. And should we like request our therapy? Are we more important than some sick kid?
This is this moral discussion that you need to have with yourself, and unfortunately I think also one of the thing is that a lot of people here to get the therapy for the rare diseases they're somehow pushed into clinical trials more often than people in developed countries, because often this is the only option that they have here. And then we come there to the stigma in terms of clinical trials and pharmacomafia. This here so spread. And we can continue on that. I would like just to touch a little bit onto your specific diagnosis. So aside that it's a genetic one, what are the disease's main characteristics? So you can live with this disease, but why is the challenge that you don't have available therapy now? And a little bit about that maybe.
So my specific disease is porphyria, acute intermittent porphyria. But there is 8 different types of porphyria. So the funny story about porphyria is that some articles, like the first Google search I can remember, the article was like disease of vampires and a royal family. And it was such a shock for me. Anyway,
definitely not the royal family.
Anyway, so the porphyria could be put into 2 major groups: cutaneous porphyrias and erythropoietic porphyrias. And there is also subtypes of those.
Which one is yours?
My would be erythropoietic, which is like hepatic or erythropoietic, with acute episodes of the attacks. So cutaneous porphyrias are sensitive to sunlight and visual light, and person can have blisters and painful blisters on their skin.
Hence the vampire association.
Correct. And for hepatic and erythropoietic porphyrias, there is a couple. So, for example, EPP, which is erythropoietic protoporphyria, they also have light sensitivity, but they also have those, I would say like it's combined type. They have also severe pain, experiencing the product when porphyrins are produced or excreted. And there is acute intermittent porphyria, we are okay with sun, but there are some certain number of patients that do have like sensitivity to light, usually with copper porphyria. But we do have those intense, severe pain in abdomen. Sometimes we would get paralyzed. We are experiencing because porphyrins are neurotoxic, so depending on the nerve that is affected, that was the easiest way for me to understand my disease. So depending on the nerve that is affected, you will have those symptoms expressed.
How you control it now?
I'm trying to avoid triggers, which would be alcohol, stress, different medications, anything that is metabolized through liver, especially cytochrome P450 is pretty problematic. So I'm taking care of my nutrition, trying to have as much sleep as possible. However, it could be pretty hard, and I'm struggling with keeping up with that. I try to take some sort of supplements, like vitamin B12, folic acid. That helps a lot. But I still feel like my legs are numb. I'm sitting for how long? Maybe 10 to 15 minutes?
20, yeah, for example.
So sometimes it's pretty hard. But being aware of what could trigger the disease and what would be like the risky period with women, it's usually luteal phase of menstrual cycle. So I have like 20 good days during the month. I usually say I can go to the moon and back, but I have also like 10 days which I spent in my bed, just sleeping, not existing for anyone but me and my dog.
That so, you maybe hear a bit on this part.
But the most important thing about every disease is to accept your disease in best possible way.
How hard it was for you to accept that?
Oh my God, the hardest thing was basically that cognitive
deterioration. Yeah.
It was so hard for me to accept it, and then to explain other people what's going on with me. Other people were also surprised, and it's still hard. I'm speaking a lot with patients in my group. It's hard to explain to people that are already experiencing the symptoms what could potentially trigger their symptoms. So,
and why it's important that, I don't know, for instance, that what you said, 10 days, you don't exist for anybody.
Exactly.
And why, this is...
And you need to like count on people that are not in the same position as you, because some people need to work. Some people have kids or families to take care of. Basically living different lives, and it's hard to explain also people from different, I would say not a cultures, but different upbringing, especially in Serbia.
Yeah.
Why they need to take care about themselves.
Yes, I think this is such a big challenge for us in Serbia, and this brings me really nice to the one part I wanted to talk to you about is I would really like to touch a little bit the system in Serbia overall, and you have a really great, you had opportunity and you're still working with developed countries, and maybe we can draw some parallels there. But talking about Serbia per se, first thing I want to touch on is the empathy of people. Mm-hmm. And how much it's hard for people to understand, or do you see that it's hard for some and some not to understand what it means to have a rare disease first, and how they can help you, to be there for you, and so on and so forth. How was your experience before and now also?
Well, I would say that people with rare diseases definitely don't like to be to have a special treatment. Mm-hmm. Mm-hmm. Because the most important thing about inclusion is that, okay, we are people.
They shouldn't feel excluded.
Exactly. Mm-hmm. Mm-hmm. So we also want to do everything that other people are doing. Mm-hmm. But we have certain limitations. Mm-hmm. So we want to be in position to do the same thing. But okay, now community needs to understand us and our needs, which is like treatments, therapies, but also to understand a vast majority of rare diseases. Mm-hmm. Some of them require special attention. Some of them require a different a workspace environment. Mm-hmm. A lot of us, I'm working. Mm-hmm. So we do need understanding.
But not victimizing.
Correct.
I wrote in my notes relevance of empathy versus victimizing and pity, you know, because you shouldn't feel that someone is pitying you.
Exactly. Yeah. We already feel inside in some small portion of our beings, oh my God, something is wrong with me, I'm faulty, but the only way to live with your disease is to accept it and to have that positive point of view, which will give you strength to live your life, right? Once I was on my psychotherapy, my therapist asked me, okay, but why am I paying so much attention to my rare disease? Because I wanted to be heard. Mm-hmm. And she just told me, I think we spoke about planning a family or something along those lines. So I wanted everyone to know that I have a rare disease. I don't have a problem to speak about it if, the people from another end will understand what I'm saying. But her point of view was, okay, but do you think that everyone is aware of their diseases? And that's the thing between visible disabilities and the ones that are not. So having a disease that it's not a visual disability, it's so hard to explain to other people because you see me now when I'm fully functional, but it's super hard for me to explain to people, okay, abruptly I can fall into my bed for the next 5 days and I cannot do much about it. And it's especially hard in your workspace environment. You will have, if you don't pay much attention to your health and all of your healthy habits during the day, and you will have pretty often sick leaves. And to be honest, there is no corporation that will say, hey, this is okay. Of course, go to a sick leave. Of course, come back when you come back. So it's pretty harsh. But to come back to the story about empathy and the thing that I mentioned in Serbia specifically, people usually don't care if they are not experiencing the rare disease, not personally, but maybe with people in their surrounding. However, I think that in Serbia, people are aware how poorly supported we are from our system. Therefore, people are sending text messages to treat kids.
Yes.
And we have a different sorts of fundraising situations. Again, the reason why I started my organization is to actually change something systematically, which is important because if you have a law about rare diseases, that law will stay. It's easy for me with like my medical background to treat my disease and to live with my disease, but after like working for 9 years in pharmacy, the most important thing that I can bring from there is that like average person that lives in Serbia, it's not someone like me or someone like you. Unfortunately. So we need to think about those people too.
We need to think about the words we are communicating and the way we send this message. Otherwise,
super simple explanation of really complicated things. And when it comes to death, when I started like my first campaign about porphyria in Serbia, I cried. I cried because in Serbia we don't have like media that will present something in a normal way. Like respecting your privacy, your standards or newspaper standards. The first cohort of articles was about like me, my sisters, my disease. When I read like the first article, I wanted to like write message to the editor to like correct this and that and this and that. And when I saw my article, it was all red. And I said, okay, this will be the price that I will pay personally. You know, let's see how this will go. The second campaign was the same. So media in Serbia is actually reaching out to people in absurd way. They are touching their lowest, deepest emotions.
Yes.
Everything is sensationalistic, which is not good because if you have like that kind of titles in your newspapers daily, nobody will notice the difference between something that is serious and among something that is not so serious.
Yeah, people are not sensitive anymore.
Right.
It's just,
It's like hyperproduction of bad journalism.
I remember when I saw these articles of yours, I couldn't even read them because I remember I read the title, and for me that was so victimizing and so dramatic.
Exactly.
That I was like, no, I don't want to even put those things in my head because I don't want to think about you in that way. You know what I mean? But as you said, average person is not someone like us, and it's hard to...
Exactly. And it was hard also, as I said, for me, it was hard to put my family into the same position. But this is the only way that you start being visible in Serbia. And guess what? After, I think, second campaign, authorities started noticing our disease. So even if you like reach out to PR agency, they would do the same. They would just tell you everyone is doing that in this way, so you can accept it, or you can just go on your way, and
There is
you
no
will
other
achieve
way.
nothing.
Yeah,
Basically.
unfortunately.
When it comes to the associations and organizations, it was my choice to follow that path, because again, I'm fighting for systematic changes. So comparing Serbia to other countries, if you are association or organization of any kind, non-governmental, you would follow some rules and legislations. You would probably have some media campaign, and then you will suggest some changes, and you can go to your parliament, file your documents, and wait for response. In Serbia, you would do the same, but you wouldn't receive response back. So in governments such is ours, it's really hard because you need to raise your voice all the time. You can go to like meetings with president of country, but you don't have, that's not like a guarantee that you will achieve something or change something.
If it's not politically appropriate for that moment, you will achieve nothing.
Exactly.
Yes. And if you don't give many things in return, unfortunately.
Exactly. So I think that community, especially people with rare diseases in Serbia, are pretty aware of that. And unfortunately, I must say that some rare diseases are treated because of like the political effects, and others are not.
How your search for medication started? Do you have now some available medication at all, or no?
So my search started after that first vampire royal family search. The next one was about available therapies. At that time, there was a clinical study for Givosiran. And I tried to apply for that study, which was happening, I think, in Poland and Bulgaria at that time. So I went through like the requirements, and I've read that I need to be recommended by my physician.
Okay.
So what I did, I went to the hematologist that gave diagnosis to my sister, and he just said, I don't think so. It's not needed. You're okay. Just eat sweets and stuff like that.
Why they are saying you should eat sweets? What is the background?
Because glucose is actually relieving the metabolism of heme in your liver.
Okay.
It's basically postponing those negative effects of those precursors. That's why it's super important. So it will not lower the porphyrins in total, but it will slow down the process itself. And when you say porphyria, there is like 8 different porphyrias there. So depending on mutation, the glucose intake could help with some in some situations, in others not really.
So basically, because of this not a recommendation, you couldn't even enter the clinical trial?
I wouldn't say just that. I think that doctors are here already swamped with different duties, like they need to be doctors, but they also need to feel like our system, our procedures are so complicated that sometimes I feel sorry for our doctors, and what I said before, especially in rare diseases community, you need people that are thinking outside of box. And if you are all into that screen, putting like the same information for the third time for the same patient, of course that you will not have enough time to provide that patient with a good healthcare service. And I won't even mention like thinking about like clinical studies and different things. So that was like the first no that I received, but I was not planning to stop there. So I wrote an email to pharmaceutical company explaining the situation. Of course, due to compliance and how it goes when you are a part of clinical trial, you cannot do whatever you want, of course. So after a couple of years, and thankfully the clinical study went pretty well. They approved the drug first by FDA, then EMA. I received an email from pharmaceutical company that medication is there and ready. Okay, so then we had to figure out the way how to approach to doctors to tell them about like this treatment.
Because then it goes another national approval for Serbia. This is another thing, yeah.
So we, unfortunately, we haven't yet approved medication in Serbia. We probably won't do that. But in Serbia, there is a way to get even those unapproved treatment via like different regulations, which would be, we say that public tenders. And there is also like the specific consortium for rare diseases. We sent, I think, 4 requests for therapy 2 years ago. We still haven't received any response. Since then, we tried with like different media campaigns. I had different meetings with Healthcare Fund, with Ministry of Health, and nothing much has changed. We, as of now, in our association, have 70 different families, which is above any numbers in any other country. And there will be probably even more. We'll probably run some research about those 2 most popular mutations. And probably have porphyria as endemic rare disease here.
Is this one-time therapy or the whole life?
This is a continuous therapy. There is unfortunately not treatment
but it helps you to live with it.
But it helps you to live. And my main concern, like, you can definitely change your lifestyle to that level that you experience attack every now and then. But again, there are people with different constitutions, with different lifestyles, and not everyone can do that change. That switch.
I think also a very important point here that we are talking about is the financial situation in Serbia. And unfortunately, living healthy in Serbia is expensive.
Yes.
Unfortunately, very much. Yes. And I think there is a lot of people who would like, of course, to change their lifestyle, but it's not available to them. This just doesn't go.
Yeah, they just can't.
If maybe now we can continue this story about this Raška part of Serbia and why so many people are suffering from this disease there.
Oh, well, it's just a often mutation. So if we if we think about like the region itself, it's there's a lot of mountain villages. It's a secluded community. So it's pretty easy to explain how there is so many of the mutation. But the problem is also like a cultural, because people don't want to talk about disease. So in Serbia, we're still experiencing that like I don't want to tell people that I have disease, because being sick, that's, something to be ashamed of.
Exactly.
So when my sister, when I started the association, we got like a sponsorship for genetic tests. And that was like 10 years after my sister got diagnosis, that I had a chance to do the test myself. And then I went back to the same hematologist that gave my sister diagnosis, to tell him, okay, can I have like a piece of paper that I have this diagnosis? Because I basically pulled out the small lab result, and I was going like 15 years. I was sick with that small paper, and I was telling people I have porphyria. So this is like the evidence. And doctors were like, okay, I can write that down. But you don't have like the official diagnosis, because one of the doctors didn't put that in computer, right? So we started doing those tests, and it really helped a lot of people to distinguish if they have like a genetic or not genetic disease. There is also a couple of patients in Serbia that they don't have genetic mutation, but they do experience seeing the symptoms of porphyria.
Interesting.
It could be that like the specific mutation was not yet recognized. And the other thing would be lead poisoning. Living in Serbia, we have a huge issue with pollution.
Yes.
So I can just say that it's not easy, even if you're taking care of everything. So what you eat, I can pay, I don't know, pretty much for good quality of food, but that will not guarantee, because I cannot pay for the air that I'm breathing, or water that I'm drinking, or the water that I'm showering with. Like it's so complicated and it's so hard, and that's why therapy is important. The other thing that therapy is a must for us would be comorbidities. So when you have porphyria, if you are not treating your disease, you can experience liver failure, kidney failure, issues with fertility, issues with your thyroid glands. Even though if you don't excrete that much porphyrins, you can still have those comorbidities. So it's super important to be aware that, okay, if I don't get my treatment now, I'll be probably needing transplantation in 10 to 20 years from now. Or because pretty often would be hepatocellular carcinoma. I would need a chemo, but I cannot get chemo just like that. I need chemo plus backup therapy for porphyria.
Because there is no point doing the chemo if you don't have,
So that's like also pharmacoeconomics. I could potentially need transplantation or dialysis or whatnot. So we would need to put on paper how much would that cost for patient, and you will see the value in getting this expensive therapy to the patients right now.
Maybe now it's a perfect opportunity to actually touch the basis what is pharmacoeconomics, why it's relevant, and why people need to understand that it's not about pharmacomafia.
Exactly.
It's about pharmacoeconomics. Yeah.
Exactly. So when it comes to therapies for rare diseases, to run an average lab, to pay those researchers, to have the access to the substances and material to produce medication, it costs in average same, usually. But sometimes what is important for those factories or pharmaceutical companies would be market access. So if you have like 1,000 patients that have diabetes, you will produce the same medication like over and over and over for those 1,000 patients.
Exactly.
But if you have one patient with one rare disease, you will produce that medication for one time only. And this is why you cannot multiply. I won't say like what you can get treating rare diseases would be just loss.
It would be,
unless the therapy is expensive, and we are not paying, just like the substance for medication, but we are paying also research, lab facilities, and whatnot.
I mean, the average time that needs for medication to reach the market is 10, 15 years,
Exactly.
right?
And
in the best case, let's say.
Best case scenario, exactly. And sometimes if you start, like if same company starts research for one substance, clinical study can fail on stage 2, for example.
Most common.
It's pretty common. So sometimes same company can run a different clinical trial for a different substance. So we need to be aware of how that works.
And also about the fact, now you mentioned the clinical trials, you need to find also patients for clinical trials.
Exactly.
Because when you have a rare disease, you have limited number of patients. And also there are certain exclusion criteria, so not even all of them cannot go and be part of clinical trials.
Exactly. And you will never have the same numbers or same evidences for rare disease treatments, like against the treatments for many other disease.
How would that work now for these public tenders that you mentioned? The idea is that the government covers that.
Correct.
There is no option that you go to some country where the therapy exists and that you take the medication there, or...
So it's pretty pretty sketchy, I would say, because you can go to other country for your therapy only if your doctor in Serbia say, okay, we cannot treat this disease, you should go somewhere abroad.
And if you say that, then you cannot really do this and get the therapy
But
here.
my doctor would never say that,
yeah.
because he did what he should do. He sent those requests to healthcare fund, and it's been 2 years now, and we are still waiting for that medication.
What is the amount of money we are talking about?
I think that therapy for a year for a patient is between 400,000 and 500,000 euros.
Okay.
Which is not like the most expensive medication. There are a lot of more expensive medications that are successfully available in Serbia. So it shouldn't be a problem. So they're probably concerned about the number of the patients with porphyria.
Yes,
But there are different stages of the disease, and there are different conditions, and we just need to have some sort of triage or priority lists of patients and start with the treatments already.
Do you think that, of course you hope that your association can help with that, but do you find that public is open to this?
Well, if they forget about me, I'm happy to remind them again and again. But my goal started being like raising awareness, and all that I can do and say is to speak about porphyria. My goal is also to inspire like professional network in Serbia, because being a part of the it's the only association in the world. Like in Europe there is Eurordis, and Eurordis has initiative that's called ERNs, which are like the network of professionals of different rare diseases and groups of rare diseases. So why I'm so proud of being part of the IPNET is actually that IPNET started long before ERN started. So it's so specific about porphyria because we managed to like establish what is most important for this disease, and that would be like the researchers, the scientific community, and patients, and
bridge this together.
And they are working together since the beginning. So this is why I'm trying to like improve the situation in Serbia, to make people write papers, like scientific papers, to start researching, because we definitely have population for research.
Definitely,
And it's going to be a magnificent job if somebody from here start writing those articles about porphyria.
And increase definitely visibility and awareness. This is, I think, crucial for this. Do you, do you manage to collect the money that you need for that work, or is this mostly self-financed?
Money is the thing that I don't think about at all. I'm so bad at that. So I'm usually financing a lot of things from my own pocket. I'm managing to like write some sort of sponsorship requests, but I'm doing my association thing for free. I have like a full-time job, and there is a lot of different stuff that is currently going on. So I don't have much time to like, having the association should be a job itself.
Exactly, yeah.
But we are not still at that level. And also there is a lot of things that you can do without money. And I think that
this is a very important message.
Exactly. So I think that I've started by doing like some of those things that I've done were also super creative workarounds. So some people are doing that with money, but I tried to do it without money. It was not that successful, but I've managed to do something. So it's not everything about money. No. It's important, like what you want to say to people, what message you want to deliver, and how you want to deliver. I'm pretty, I wouldn't say like angry person, but I want to be heard. And I want to for people not to like, to understand what I'm saying, And if I need to say one thing in 5 different ways, I'm going to do that. Again, I was crying when I first read the articles, but right now I completely accepted that.
That is the way. Yeah.
That's the way. And some people would learn about disease in that way. That's okay. We got like 30 people understanding about porphyria AIDS. But I need also to be like super serious when I'm speaking about porphyria to medical professionals, because they need to understand that like the 2 paragraphs that they read at medical university are accurate, but they are not. We moved from that 1 or 2 paragraphs many years ago, a lot. So now my goal is to speak not just as a patient, but also as a pharmacist to the doctors, to say, okay, I went to like different countries. I spoke with the people about porphyria. I'm offering to our doctors consultations with those professionals that are treating porphyria for more than 40 years. They are doing a lot of research. They are treating patients with 2 different therapies. They have a lot of experience with that. So I'm trying to bring that to Serbia now. And sometimes it's pretty hard to, again, inspire people that are overworked and underpaid and exhausted to like be a researcher.
And open the mind.
Yeah.
I think they don't have energy for that, unfortunately. Yeah. And this is something that we are, I think all of us are trying to instill this small, change. Just a bit, and then hopefully we have this systematic change that you mentioned. When you said also that when we touch these comorbidities, how you accept that there is a high chance for you to struggle with those kind of diseases?
Well, I'm so afraid. I'm trying not to think about it constantly. So I like to be a problem solver. When, like, personally, when my friends are starting to like say something or sharing some problems and issues with me, I would ask them, do you want like me to just listen, or do you want my suggestion to resolve the issue? And I could be like a brutally honest. So that's how I'm with myself. Okay, I know what I have. That's great. I know what I should do and what I shouldn't do, and that's okay as well. I'm also aware of risks. If I do something that I shouldn't do, what can I expect? So that's also great. What can I also do? I can also teach other people to do the same thing. So I'm not alone. Okay, do I have a treatment for this? Yes, I have. How to get that treatment? Okay, there are a couple of different ways. Okay, let's try them. Who else needs to know about this? We call those people like stakeholders.
Yes.
But stakeholders are actually all the people involved in certain issues. So we have doctors, we have patients, we have families of patients, we have also social system, we have also corporations, we have also community and population. We have so many stakeholders, decision makers, political decision makers. So we need to tackle each group in certain way, and this is how you raise awareness. Actually, some of them are successfully aware, some of them are not, but you should keep trying. And the main goal is to change something systematically, because number one reason why I started my association is to share all my knowledge with people that don't know what I know, so they don't feel the same pain, the same frustration, the same struggle that I felt. And you will hear probably a lot of similar stories in rare disease communities. Sometimes rare disease advocates are patients, sometimes it's parents, sometimes it's siblings. So it's really, really hard to fight with rare diseases or live with rare disease. Again, I just mentioned like here and there, but there are treatable rare diseases. There are untreatable rare diseases. And it's complex and layered on so many levels that you really need to get there to understand how important it is for everyone to learn about rare diseases, because I would say that those are diseases of our future.
They are, unfortunately, yes. Because there are so many conditions right now, for instance, that people are suffering and they are not identified, right? And they are all attributed to stress. But the question is whether that's only stress or there are so many underlying rare diseases that we still don't know about.
Exactly. When it comes to like mutations, you have like known mutations and known mechanisms of mutations, but there are also mutations that could happen rapidly in pregnancy. There are also mutations that could happen during the lifetime. So,
and I think the important point you touched there is that somehow you change that mindset, right? And exactly what we talked about, that you expect from other people, that they are not victimizing you. You are also not victimizing yourself, but you somehow sit and try to find a solution, whatever that is. And I think that is a very important message to share, because no matter which kind of diseases there is, it's important to somehow try to find a way to live with it, even if it's at certain point terminal and you cannot live with it.
Of course. I mean, you need to accept, and I would use the word progress, even though that's not that accurate. I'm not sure how much we are progressing, like humankind. But there is definitely a progress, and you need to be aware of the progress itself. So we didn't have issues with allergies like 100 years ago, right?
Definitely.
So it started to be a new disease, and pretty often. So that's why rare diseases will probably become more and more often, because, as I mentioned, like pollution here is insane. So mutation could happen not just because of stress. It could happen also because of pollution in air or in water or whatnot, in food. Pesticides also, like soil.
So many.
So, but I just don't want to people to panic. Stuff happens. But when you are aware of like all the issues, and when you approach them with attention to solve them, it's way different than just, panicking or crying over your destiny, because we are all doomed. So that's why you need to change, even if you are a patient, like sharing your story is something that will definitely change not one, maybe 20 or 200 lives. That's why it is important to share stories and talk about
Yeah, I mean, one thing where we can see that a lot is the mental health, right? Because I think for those patients that I am one of them actually, this is always a challenge because you don't have physical problems, right?
Exactly.
And it's always, yeah, it's nothing wrong with you. You are just depressed or whatever, or just, you know, you are, I don't know. You don't have, typical in Serbian is you don't have what to do, you are bored. And I mean, with raising awareness starting late 90s and further now, these things are really understood and getting there. Even and maybe in underdeveloped countries like Serbia, this is still a challenge, and I feel it on my skin every day. Unfortunately, even from my parents, not because they want to, but they just cannot understand. But we are getting there, and I think with rare diseases will be similar. We just need to really talk about that a lot. So,
The funny story is that I had the issue that I've mentioned, that people are shy to speak about diseases. I had that in my family.
Mm-hmm.
So when my sister was diagnosed and we confirmed that I have it as well, I've made like the Facebook group of all of my relatives. And I just told them, okay, everyone, we have porphyria in family. Please follow the symptoms, this, and that. Try to go to your doctor. Try to ask for the specific test, because you cannot like get it straightforward. You need to like ask specific biochemical test even. And they were like, oh, we know, for about like 40 years. And I was so mad. And the story, it doesn't end there. So I was a kid, like I was 6 or 7 years old. That was about the time my dad was in military. So it was exhausting period for him. So he had an attack. But my grandma didn't tell doctors that we have porphyria in family. So he was wrongly diagnosed with schizophrenia. He went to the hospital. They started giving him like barbiturates, which are contraindicated with porphyria. So they made him even worse. So he was like a funny case that once he was released from the hospital,
he was bad.
And when he stopped taking his medications, he was better. So, and it was hard because it was also stigma for the family. I definitely can say that as a kid, I didn't feel that my father was that present. So that's why it is important also to learn about rare diseases, because you never know who will be affected other than the person that is having the rare disease.
Exactly. Yeah.
That's why it's like not just a healthcare issue, it's a sociological issue, psychological issue, and a historical issue, I would say.
Yeah, yeah.
And it's also now from a distance, when I'm speaking with my patients in my association, I'm trying to explain like different points of view, and it's so important for me to have that feeling, like to give them holistic approach and support, because it's not people are coming to the association in different stages. Some of them are not yet aware if they have or they don't have porphyria. Some of them have spouses that are hospitalized. So I'm not speaking even with a patient. I'm speaking with family members. Some of them had porphyria attack like 20 years ago. So right now they are going through those comorbidities. So having like the patient association is actually super important for people with rare diseases, because you can see yourself, like you can mirror yourself throughout the years or stages or circumstances, and that's so valuable to patients.
What would you give as a message to people who don't have a rare disease?
I would stick to what I said. I think that rare diseases are diseases of a future. So try to learn as quickly as possible about rare diseases, because you never know.
Yeah, that's true. And to patients?
And to patients, to fighters, to survivors. I think that they are most inspiring, the strongest people that I've ever met.
They're special kind of people, I would say.
They are so stubborn. They are so with such a strong opinion, and they are sharp, and I'm so happy that I'm surrounded by those people.
Yeah, that's very nice to hear. Thank you. I hope that with this we can contribute to a little bit to raising this awareness.
Thank you.
Thank you.